Communication seems so easy, doesn't it? That is, until you put on a mask, a visor, loads of plastic, add in the noise of a busy hospital, and suddenly it's not so easy anymore. Now, sometimes you can fudge your way through this, but in important situations, like an arrest for example, it's probably best not to sound like Bane.
Well, brothers, it is a shockable rhythm, so we can get adrenaline and it's
So, what should we do while wearing PPE? Well, it wouldn't be medicine if it didn't have 3 things. Number 1, make sure you can see the person you're communicating with. Yes, it sounds stupid, but we've all been task focused before, looking at the patient, looking at a monitor, and not actually looking at the person we're trying to talk to. When you're wearing PPE and people need to see some cues, it's vitally important that you make sure they can see you and you can see them. Number 2, feedback. We'll talk about this now so that you can bear it in mind going forward. But basically, it's really important that essential information is both received and understood. So if I say something to you, I don't just move on. I wait for you to acknowledge it, repeat it back to me so that I know you got the message, and then I'm comfortable that you've got the right communication. So for example,
I would like more coffee in my mug.
Okay, you would like more coffee in your mug.
Yes, that is right. Ha 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 ha.
Number 3, hand signals. So even with great verbal communication and people feeding back and you looking at them, it's still going to be loud, you're still going to be wearing PPE, and you still might not be able to hear what's going on. So hand signals are super important. Now, I'm not going to go through every single hand signal there is. You guys will probably come up with your own in your hospitals, but there are a few which are universal, which you should learn. If you've gone diving before, you'll probably know some of these, but let's go through the most important hand signals for you to learn in hospital. Pointing! Don't listen to your mum, it's not rude. Point at everything. Point at you, point at me, point at the patient, point at the chicken tikka wrap for lunch. Listen to me. Look, 2 fingers or 1 finger, look at my chicken tikka wrap. Remember, don't touch your PPE while you're doing this or this. Top tip. Okay, or yes, or understood. No. Incorrect. Stop. Now, this one's important. Something's wrong, because things are often wrong. Something's wrong with the defibrillator. Something's wrong with my glasses. More or more, less or less. Time. Important in things like ALS, time 2 minutes, or time for lunch. So there you have it, 3 things that ensure good communication whilst wearing PPE. Always look at the person you're talking to, make sure there's good feedback between both of you, and keep those hand signals going at all times. So I hope this helps. There's a poster you can download below which has got all the hand signals on, stick it up in the hospital, email it around, and I would recommend practicing these things before you go into the red zone. So just have a chat with your colleague, you can run some medical OSCEs, but also find out how many sugars someone wants in their tea or what they had for lunch or for breakfast. See if you can use hand signals to communicate really simple things, because then when you go into an emergency situation, it should all come second nature. Okay, bye bye.